This presentation will be about qualitative research designs. You have seen this schematic before. We talked about it in the very beginning of class, and then last week we really covered everything on the quant side, talking about the differences between experimental design and quasi-experimental design, and then breaking that down further into correlational and descriptive that are non-experimental, so we don't manipulate anything. This is on the positivist paradigm and on the quantitative side. This week we'll focus on the qualitative side, and the naturalist or the constructivist is the same thing, paradigm. And so we'll go over what ethnography, phenomenology is, grounded theory, case study, historiography, all of these different types of design. It isn't difficult, but it's new terminology. So with qualitative research, this is just a little bit of a review. It focuses on the words, and it focuses on the human experience and what that means. So it can't be measured with numbers. It assumes people's and their perceptions and realities are different. You might remember that from that constructivist or naturalistic approach. It is more holistic in nature, and it assumes life means more than facts. We don't use a hypothesis, we don't use variables. This is kind of a groundwork type of research unless you're just a qualitative researcher. And I'll give you a little bit more information on what this research entails, because it's not easy, even though sometimes it gets a bad rap. It's very effective in nature, so many nurses do tend to lean more qualitative until they realize just how hard it is to do this type of research. The researcher is the instrument, so the research is only as good as the researcher. There is participant involvement and observation. There are interviews. They can be verbal, but as I've told you in the past, the researcher is writing down all the nonverbal cues and trying to match this up. So it takes a lot of time to do this. There's a lot of listening, and it can be very exhausting because they aren't just trying to listen, but they also have to be present in the situation and try to line up with everything that's going on in the stories that they are trying to tell the world. The researcher needs to be very sensitive, very intuitive. If they are doing interviews and not just using qualitative tools to get the interviews that the person writes, if they're doing face-to-face interviews, which is stronger qualitative research, then they have got to really be good interviewers. So this takes practice. It is better to use a setting where the participant feels most comfortable. So they prefer that this is usually done at home, but then that can also lead to some safety issues. So sometimes they will try to meet in a very neutral location. But a real world setting is best. If we were doing qualitative research on nurses, we would want to do it on the unit that they're working in. Inductive research instead of deductive is qualitative. Deductive research is very linear. You follow in the steps and you come up with the answer to your question. I'm asking you to do deductive research for your posters. Inductive research is more global because you're basically going backwards to try to figure out your question. Inductive research builds ideas, concepts, and theory rather than test them, where in quantitative we test these ideas, concepts, and theories. The results are usually in the form of words, and then we try to come up with themes, categories, concepts. Constructs would be another term that we might be looking at, and then finally we might even be creating a brand new theory. And then a quantitative researcher would test that theory. So that's a little bit of the differences. Honestly, just think of it that deductive is step by step. Inductive research is very global in nature, and it's building new material rather than testing it, and it's in words instead of numbers, so it's a little bit different in terms of measurement. It's backwards from quantitative. The best thing about qualitative research is that if you have been seeing some of these that you're looking at, these are really rich descriptive findings, and some of them can almost be poetic and artistic in nature. We're trying to get the reader to get a really accurate picture of a day in the life or a snapshot of the life of the participants that have been involved in the study. This is one reason that it's not uncommon to see very small sample sizes in qualitative research. It uses emerging and flexible designs, meaning that instead of being real set in stone with the quantitative types of designs that we talked about that are pretty easy to pick out in the literature, was this true experimental, was this quasi-experimental, did they not manipulate anything here? We're not looking at that at all with qualitative, because they are trying to figure out what design they're using almost during the process, and that's why it's so backwards, because the design emerges. So I have talked about this grand tour question in the past, but just as a reminder, the grand tour question would be one real broad question that the researcher might start out with, and then depending on what the participant says and answers, then they build off of that. And so that's what emergent means, and very flexible. The participant drives the study, not the researcher. The researcher is the research instrument. The whole process should be very fluid with ebb and flow. And researchers must have a tolerance for ambiguity. And this is important because they might get some really good information, and I think I've talked about this in the past too, but just as a reminder, they might get some really good information on, let's say, a firefighter that they're interviewing. But if they include that information in the report that's to be published, anybody who knew that firefighter, even though they're leaving out names, would be able to pick out who that is. So the qualitative researcher has to make sure that they can get the rich information that they need and still protect the anonymity of the participants. The purpose of this type of research is to understand a phenomenon that we really don't know anything about yet. So it gives us new perspectives, a change in an idea, hopefully a change for bedside care and patient care. It is for research only. We don't predict and control with qualitative studies. We identify a new phenomenon. We name a new phenomenon. We describe and we explore a brand new phenomenon. And then we explain what we think we found out about the new phenomenon. But we don't predict or control the phenomenon that we are looking into with qualitative research. Whereas with quantitative, you can come up with a hypothesis and you can manipulate variables to test things and come up with that cause and effect relationship. That's not going on here at all. So this is just a table to explain some of the differences. So this might be with identifying name, what is this phenomenon? What's it called? Describing it, how prevalent is it? How often does it happen? What are the characteristics of this? This could happen, descriptive can happen in quantitative too. It tends to lean more qualitative, but we do have descriptive studies in quantitative. If we're measuring prevalence, then it's going to be quantitative. This also comes into play when we talk about mixed methods. Explore and explain what factors are related to this phenomenon, what factors precede this, what is the process by which this evolves. Certainly leans more qualitative in nature, but if we're measuring anything numerically, then it could be quantitative. Predict and control are quantitative only. Questions like, what will happen if, we manipulate this? What are the measurable associations between factors of this phenomenon? When this occurs, does Y also occur? So that's very easy to pick out that this is quantitative. We're looking for cause and effect there. Control. How can I make this happen? Can I control the occurrence of this phenomenon? Can I alter the outcome of this situation? If I'm trying to control for a specific type of intervention and seeing what happens afterwards, that's quantitative only. So, knowing this, if we're going to do a qualitative study, or in your case, you are looking at some qualitative studies when you did your reviews for your posters, hopefully you found some, because I think it's good to look at both, then you want to make sure that it's an appropriate topic. You shouldn't be finding qualitative studies, and just as a reminder, your study should be within the last 5 to 10 years unless you're looking at classical literature. Theoretical frameworks from Erickson or somebody like that would be classical literature, so you could support it. But if you're looking to answer a question currently at the bedside, you're going to have to really be able to support why you might be looking at something classical. So if you are looking at hand washing, for example, this is not something that is not well understood. So it needs to be an appropriate topic. I've given you the example of online grieving because we don't understand it right now. Can the issue be researched by a qualitative naturalistic approach? Can we be effective in nature in this one? And then finally, if you're the one doing the research, are you the person to do it? Maybe, maybe not. Those are things that the researcher, when they're asking a question, has to try to decide. The research question actually evolves. So they come up with a real broad question at first, and then it emerges and is more refined during the study. So this is what is inductive about this and a little backwards from the other type of research. Results will be about the question that evolved, not the broad question that actually started. And then this is also a little bit different. In the qualitative study that I was involved in, we did do the literature review ahead of time, but I do know for a fact that some researchers, and qualitative researchers it is, feel that it will bias them as the research instrument when they're doing their study and asking questions. So some researchers feel that they need to do the literature review after they've done their research so that it doesn't bias them as the research instrument. So they're trying to get the insider perspective first. This is very different from the methods that we talked about last week with quantitative, because there's no independent variable or dependent variable that we have to identify. There is no hypothesis. There's no manipulation. There's no control and experimental group. They don't randomize. They are just trying to explain and justify their particular approach to the study. And it's very emergent, meaning that the study evolves based on what's going on with the participants. And it's very, very iterative. So more interpretive. It's being interpreted as they move along in the study. And again, it's participant driven. They need to be accepted by the participants, so it's like they're trying to get in the fold, if you will. must gain entry. So like if I was going to do, and we're going to talk about the different types, but if I was going to do ethnography, then I would be doing a cultural type of a study, and I might want to be living in that particular culture. You can do ethnography with nursing units too, but even then you would need to get into the fold. So there's official entrance and unofficial acceptance. They're the gatekeepers, because the participants are purposefully selected. It's not random at all because of the methodology that they're using. If I'm doing feminology, I want that lived experience, so there's certain people that I would pick to be in the study, and they would have to accept just as any other informed consent process, but it is very purposeful. There's nothing random about it, and then you want to try to be in the fold. The collection of data has to be very rigorous in order for this type of evidence to have any clout and strength. There can be individual interviews, focus interviews, there can be some observations, and those observations are usually taking place during those interview processes, and notes are being taken by the researcher. And then there's multiple documents on this. Everything's very detailed and explained. You can find some tables with numbers, and that is usually because the researcher is using some type of a computer program to count the number of words that are said multiple times by different participants. That's how they come up with some of their themes. So sometimes there is a little bit of numbering involved with this, even though we say that this is the word type of research, but that's only so that they can come up with the correct words to identify themes. This can take a really long time. They will tell us how long they spent interviewing these participants and how many times they interviewed the participants and how long data was collected. In some of these studies, it can be 6 months to a year. So it really gets a bad rap, but my point being is that this takes a lot of time, and if they're doing it correctly, it really should have some rigor, and it gives us a great start for things that we don't understand. Again, data collection should be very rigorous. One of the ways that they do this is bracketing, and this is the researcher trying to lay aside any preconceived notions about what's being studied and unknowing. And so they're making notes out to the side of their interviews and noting any bias that they have, and that's supposed to help them unknow a preconceived idea. Or they might be thinking about this beforehand if they are already aware of some of their bias and bracketing those ideas. I know that sounds strange, but that's actually part of the rigor of qualitative research. Intuiting is a qualitative term to focus all awareness and energy to try and gain the emic perspective. So they're saying that they're putting everything aside so that they can focus on hearing and being present in what the participant is saying. Again, this is extremely effective in nature. We used to have a lot more qualitative research with nurses because, as you should probably already be aware, there's some real research, like hard research, on nursing and intuition. And so they're saying that somebody who is a very good qualitative research has this intuitive process to know what to ask next to get the information that they're seeking, because they have a real good understanding of the participant. So there's some kind of out there terms with qualitative, but a good explanation as to why that actually adds rigor. Ethical considerations are not a lot different here than they are with quantitative. Process consent is, we're going to get an informed consent before we start talking to our participants. You still have to go through an IRB, and sometimes, depending on what's being looked at, it really gets into psychological considerations in terms of if the risk is going to be greater than the benefit. So there still is really a informed consent, but then we also do a process consent each time before we start an interview. Of course, we have to maintain confidentiality. You're getting invited into someone else's life if you get the opportunity to be a qualitative research, so you have to understand that it is kind of an intrusion. And we want to try to keep the participant from being disappointed, feeling betrayed, feeling deserted, because you've gotten in the fold, and then when you're done, see ya. So, there's a very strict process on how all of this works. We have to acknowledge possible consequences to self. If you're working for 2 years on research that has to do with grief and loss, I have to tell you, you might end up on some antidepressants because it's sad things that you're experiencing and hearing from other people, and when you're trying to really listen to the participant, it is possible that there can be consequences to the researcher. The participants are not allowed to share information or retract information that's already been shared, and then they're made aware of this. Participants can use pseudonyms so that, if somebody's name is Steve Jones, the pseudonym might be Gary Glass. I'm completely making this up, because they want to make sure to protect their confidentiality. And the therapeutic imperative rules, and what that means is that if something happens during this process that we feel that either the researcher or the participant is being psychologically harmed in any way, then it stops. The data analysis interpretation with qualitative research doesn't occur after, like it does with quantitative. It happens simultaneously. So while they're documenting their thought processes and their bracketing, they are doing some type of analysis interpretation. They stop collecting data at data saturation, meaning that they feel like they've been able to answer the question effectively. Trustworthiness of the data and its interpretation is usually checked, they call it member checks, with the participants to say, these are the themes that I came up with, and these are the definitions for the themes, and do you feel that this is a good match to tell your story? And that is a piece that is actually considered very rigorous. And then finally, they communicate the findings in publications and presentations. The qualitative writing style is very different. Quantitative writing style is APA, 6th edition. It's very business-like. It's using, we use present tense, but we don't use I and we and they. You can't use that in quantitative research. It's very technical type of writing. In qualitative research, though, because we're telling people stories, it can be personal, engaging, warm. It can be written in the first person. It uses very rich and thick descriptions, should be believable and realistic. It provides evidence of the themes. If they are doing a cultural type of a study, it should be ethnically sound, excuse me. And if they are writing about the participant's story, they need to give the participant his or her own voice in this story. And really, qualitative research is telling a story, so it's different. and they are to use pseudonyms to protect the confidentiality of the participants. They need to disguise the few participants that they are using to protect their confidentiality and anonymity. The researcher is the instrument, so they choose what they can and can't report, and I talked about that a little bit already, that they might have something really good that they'd like to report, but they realize that anybody who knows that person would be able to pick it out of the report, and so then they will choose not to report that piece because they've been in the fold and they've developed this trust. The integrity of the researcher is very important in the writing of this report. It's important to the people that are reading the evidence. So in nursing research, it would be the other nurses reading the evidence. But it's also very important to current and future participants, because you've got to maintain the trust of the people that you had in the study, or other people may not want to be in your studies in the future. Okay, down to the nitty-gritty. Phenomenology, ethnography, and grounded theory are the three different types. Just another picture shows you there's ethnography, phenomenology, grounded theory, case study, and historiography. I'm focusing on the three types that we discussed previously, but a case study, you guys have read these before, that's done on one person, and a historiography might be done if we were talking about an example that I've seen in the research that's qualitative was a review on men in nursing, from the history of it. So it's usually pretty easy to pick those out. Phenomenology is also really easy to pick out. This is really where qualitative research started. It is very philosophical and psychological. Anytime you see lived experience in the title, boom, it's phenomenology. It is the essence. It is the story of the phenomenon. You are telling the lived experience of patients who have experienced miscarriages. You are telling the lived experience of nurses working in a traumatic experience. I'm just trying to come up with ideas, but you will see the terms lived experience in the title most of the time. It's really getting the story of the people that they are interviewing. There is descriptive, and that's talking about the human experience, and here's some sample research questions. What was the lived experience of caring for a family member with cystic fibrosis? What are the lived experiences of micturition problems and dwelling catheter treatment and sexual life consequences of men with prostate cancer? Here's one that doesn't say lived experience, but we know it's still a descriptive type of phenomenology. What was the experience of gynecological cancer like for you? That would be maybe a broad grand tour question that they started with in that study. Interpretive is asking, what does their experience mean to other people? What is the meaning that Southeast Asian women ascribe to the postpartum period? To explore the meaning of health among midlife Russian-speaking women from the former Soviet Union. What do you think about the meaning of caring as a provider of care to the elderly? So again, they're trying to look at the lived experience of the people that they're asking the questions to, but instead of just finding out what it means to them, they want to know what it means to other people. Data collection, in-depth conversations. They are looking for the interviewer's perspective. The researcher listens, makes notes. What was that like? Tell me more. The researcher as an instrument is really using their therapeutic communication skills to get more and more and more information out of the participants. The interviews are recorded and transcribed verbatim, so it is really nice if the researcher has some grant money to help them, because transcribing verbatim is no fun. It takes hours and hours and hours and hours if you aren't somebody who's a transcriber. I know this from personal experience. It was not fun. Participants are usually less than 10 in a phenomenological study. That's a hard word to say. You may need more than one interview. It could be 2 or 3 interviews, and then there's participant and process consent with each time. And then they continue until data saturation is reached, until they feel like they have enough information to answer the question. This is not different. I've really kind of talked about this already. Data analysis is done as during the data collection. They're using this inductive reasoning, which means that they are working backwards and synthesizing what they have gotten from the participant. They live in the data. Then they extract themes and categorize ideas. They might use some computer programs to help them do this. You can transcribe things verbatim into a Word document, and then put it into a qualitative type of a computer program, a data software kind of program that counts how many times something specific has been said, and then that helps to develop themes. People who have done qualitative research forever, they may not use that because they may have comfortability with this type of research to be able to count it on their own. They're trying to find the essence of the description of the lived experience, or they're trying to find the meaning of the phenomenon and how that impacts other people. The lived experience of transfer from ICU to the war. To identify the needs of individual family members of a relative who sustained a severe TBI, and to determine if these needs change over time. Those are examples of phenomenology. Lived experience would be very descriptive. To identify the needs of individual family members of a relative who sustained a severe TBI, and to determine if these needs change over time. They are really looking to see how this impacts other people, if you read into that a little bit more. Ethnography. This is a portrait of a people, and I always think of ethnography as very cultural in nature. Its roots are in anthropology. The assumption is that human groups evolve and a culture gives direction to their lives. So the goal for this type of research is to learn a cultural group's paradigm, their worldview, from the members. And we're trying to get that imic perspective, that internal perspective. And then we reveal tactic knowledge, not just surface knowledge. So you're trying to get in deep with these people. You've seen ethnographical reports on TV. Some of our reporters get an ethnographical report. An example I can think of is reporters that are embedded with the military. That's a type of ethnography. Characteristics. What's happening in this culture? 2 types. Macroethnography. Examples would be like Fiji and Iran. And then micro. So NICU, Senior Citizen Center. So obviously macro is on a large scale and micro is on a smaller scale. Both involve field work. You got to live in this culture. Data collection, in-depth interviews. This one can take years. Phenomenology can take 6 months to a year. Some people do it quicker than that. It kind of depends on how in-depth they're getting. But ethnography is really trying to embed themselves into a culture, so it can take a really long time. The researcher should be right there, and the participant is really the observer. You have to get a backstage invitation to this type of research, or you're not going to get any kind of good data. This These types of studies will also use newspapers, photos, diaries, and we call those, I cannot think of what I call what those are called, but I'm not going to test you over that, but artifacts, there we go. So it really does have this anthropology background. We are trying to find out with ethnography what is done in a culture. With the artifacts, what is made and used. And with speech, what is actually said. And what's that mean? So they're looking for meaning of things like artifacts, meaning of events, meaning of practices, and it uses rich descriptions that help readers understand the specific culture. Here's some examples. The healthcare environment on a locked psych ward, an ethnographic study. Vigilant watching over mothers' actions to safeguard their premature babies in the newborn intensive care nursery. Grounded theory is a little bit more difficult to pick out, in my opinion. This has its roots in sociology and symbolic interactionism. People and their actions can't be understood outside the context in which they live. So basically, with grounded theory, they are not using a theoretical framework. Again, it's this very inductive process, and in the end, ideally, they come up with a new theory. It's possible to find patterns in all of social life is an assumption that people who are using this type of qualitative research use. And the goal is to discover what problems exist in a social arena and the process that people use to handle those problems. So grounded theory is not a theory itself, and this oftentimes gets misinterpreted by students learning research. I was also confused by it, so let me put that out there. It is a type of qualitative research. Some questions that someone using this type of process might ask would, what is the chief concern or problem for people in this situation? How do they make sense of it or deal with it interpersonally? Theory development that is grounded in the data. So that's the key here. Grounded theory, their real goal is at the end, after they've answered the question, they develop a new theory. But they're going about it in a different manner than what we typically think of with deductive, with quantitative, and it's all in a step-by-step process. With this one, they're asking all of the questions, they're gathering all the data, they're doing the data analysis and collection at the same time, and then they come up with a theory at the end. Instead of where with quantitative we're trying to start with a theory that's well known and use that as our foundation. So this is a great example of how deductive with quantitative and inductive with qualitative is very different. With data collection and grounded theory, they go into the field to study interactions. They also can do in-depth interviews, formal and informal. They have some participant observations, so they're writing down things that they see. And then they can also look at some existing documents. This one usually has about 25 to 50 people being studied. Simultaneous data collection, coding, and analysis. That's not different. There's a constant comparison being done. And themes usually suggest that there's additional data needed, so they keep going. Here's some grounded theory examples. Stressors in nurse anesthesia programs and how students dealt with them. How school nurses become empowered. To explore the impact of caring for a spouse who has incontinence in the home context. This is also an example of how I would not have been able to read those as a student where you are now and not get them confused with something else. So for our purposes, what I would like for you to know about grounded theory is that it is a qualitative approach and that it uses inductive processes to come up with a theory at the end of the research. I am not going to give you an example and ask you to pick it out unless it absolutely says grounded theory in it. Other qualitative designs, that case study is an individual family, it's an individual family, it's an individual unit, it's an individual hospital, it's very short ethnography. A woman with PMS. These are easy to pick out. It will say case study on a burn. So it's usually very easy to pick out a case study. And then historiography is historical research. I also think these are easy to pick out. The calling to practice nursing. Men in nursing, a historical review. I've seen things like that, and you probably have too. This week you are working in your groups instead of doing discussion boards, and I need to catch up on your discussion boards. I apologize. I have had an entire family with the flu. I have also tested positive for influenza A, and we are on Tamiflu now. Not everybody got it because it was too late, but what you are going to need to do this week is work in your groups to do your critique, and there is a instruction form on that. Of course, you may call and I will answer questions. You may text, you may send emails, but you are going to pick either the qualitative article or the quantitative article, and as a group answer the questions that are on the instructions to critically review that article. This is what I'm asking you to do with your 6 to 10 for your poster and putting those into each of those sections. When you're looking at your discussion boards, make sure that you're looking at the guidelines for the posters, because that's what we're trying to do in the end, is come up with your posters. And so we're to the point now where you are critically reviewing all of the research that you have to be able to answer your questions. And so this week, the only thing I'm asking you to do is, as a group, pick either the qualitative or the quantitative article that I have provided and do the critical review according to the instructions. God bless you and have a good week.